Well, good morning, and Bassam, thank you so much for that introduction. Andrea, for the very moving talk and your personal experience trying to navigate through a very broken healthcare system. As Bassam said, that's why I wrote the book, Mistreated, why we think we're getting good healthcare and why we're usually wrong. And by the way, all profits will be donated to Doctors Without Borders. So it's really a move to change the landscape of American healthcare. And I wrote the book for what I called the patient in all of us, because we're all patients at some point. But what I've really learned as I've gone around and I had the chance to be on TV and radio and giving 14 talks this month alone, is that it's going to require more than the patient. And I believe what it's going to require are the major businesses, many of whom are in the room today. I think it's $50 billion of net revenue or something sitting in the room today. Not personal, don't get me wrong, just for your companies. But I do want to stress the fact that I believe that if every major purchaser demanded, gave medicine 5 years to make the changes I'm going to talk about this morning, that physicians and hospitals would find the way to make the changes necessary to save the lives of hundreds of thousands of people every year and provide care that was far more affordable than it is at present. Andrea said we've got to start with a story, so I'll start with a story. And the story is that of my father. Jack Pearl was the son of 2 immigrant parents. He worked his way through college and through dental school. In World War II, he could have stayed behind American lines, but volunteered for the 101st Airborne, parachuted on D-Day. He and his troop were captured by the Germans. He led a daring escape through the forest in the dark of night, brought everyone back safely, truly what Tom Brokaw would call the greatest generation. He was a man of tremendous energy, slept maybe 4 hours a night. And then one day he had an experience that he'd never had before. He was tired. He went to the physician and diagnosed with what's called a hemolytic anemia. For those of you who are not physicians in the room, that means the red blood cells in your body, often injured by a medication you have taken, get broken down prematurely and your blood count drops, and that's why his energy went away. He received medication which didn't do very much good and had to have his spleen taken out. The spleen sits on the left upper side of your abdomen. And it's a filter. It filters out these damaged red cells, but it also filters out various bacteria. And in particular, one bacterium called the pneumococcus, which because of its capsule is resistant to many of the antibodies of the body produces. Now, my dad lived half of the year in New York and half of the year in Florida. And remember, my brother, who, by the way, is chairman of anesthesia at Stanford, and I are both physicians with a lot of knowledge. We handpicked his doctors. They were great. But the ones in New York thought the ones in Florida had given him the necessary vaccine called the Pneumovax. The ones in Florida thought the ones in New York had given it. Primary care was sure the specialists had done it. Specialists were sure primary care had done it. And in the end, he never had it. A couple of years later, he came out to visit my brother and me at dinner at my house and went to Ron's house in Palo Alto. Ron got up at 5 o'clock in the morning for his rounds at Stanford, found my dad on the floor, unresponsive. 4 days in the ICU, unresponsive, 3 weeks in the hospital. He survived the episode, but he never recovered from the complications of his problem and his stay. He was one of 200,000 people that year to die from a preventable medical error. When you add the people who don't get the necessary preventive treatment, people who don't get the chronic diseases treated well enough to avoid complications, you have almost 500,000 people in the United States today who die prematurely or unnecessarily. And many of them are your employees. And I'll make the point today that you don't know that that is happening because the system is so broken, there is no way for you to find out. So today I'm going to cover 5 areas. I want to talk about why I believe that the health care you provide is not as good as you think it is. I want to talk about the fallacy of choice. I want to emphasize while the focus on unit price is important and bundled payments may be important, in the long run it's not going to make much difference. I want to offer a roadmap to the future with 4 pillars. And then I want to conclude by the things that are necessary and what's going to happen to American healthcare if radical, significant change does not occur. So let me begin with the reasons why I believe that what you're providing, if you're a company buying insurance to your people, or if you're an insurance company itself, what you're offering as part of your offerings of your provider, the care that you're providing, is not as good as you think that it might be. And let me start with the fact that our nation spends 50% more than any other country on health care, and that our results, a lot of talking going on over there, I don't know, keeps hearing in the room. And the result is that the care we provide is in the lower half of the 20 most industrialized nations of the world. The American healthcare system is last in life expectancy, second to last in childhood mortality. In fact, there's not a measure of quality outcomes in which we lead the world. Tomorrow I'll be speaking here again and talking about why we have that misperception and emphasizing how context shapes perception and changes behavior. But today I want to focus on the things that are most relevant to you in the insurance and the obtaining a care for employee space. We tolerate in healthcare things we never would tolerate in the rest of our lives. I mean, think about it. Imagine if your financial advisor said to you, you can have all the information you want on your investments anytime you want it, as long as it's Monday to Friday, 9 to 5. That's the reality for most Americans if they want to know their laboratory results or the pathology results or the radiology results. How many of you hold on the line to make a flight reservation? And yet all of you most likely have to wait online to make an appointment with a physician, even for a routine, relatively small problem. We tolerate in healthcare that which we would not tolerate in any other part of our life. And we seemingly do it without complaining. Take even one small example, hypertension. High blood pressure is the #1 cause of stroke. What we see across the United States is that only 55% of the time is it well controlled. In the best organizations, the ones I'll be talking about that are integrated and capitated with technology, it's 90%. The difference between 55% and 90% is a 40% reduction in ischemic strokes. And I don't know how many of you could tell me how well the care your employees get is managed at that level. And more significantly, as in my father's case, who's to blame if it's not? Is it primary care? Is it specialty care? Who's to blame in that arena? It is simply an opaque box. American healthcare today, whether you're looking at cost or whether you're looking at quality. Maybe with Yelp you have a little bit of insights into the service piece, but that's about all that is there. I personally believe that the notion of choice is left over from almost 100 years ago, at a time that medicine was very, very different. At a time when most people got acute injuries or acute medical problems and wanted to go to a doctor who was close by. Travel was expensive at the time, and teams were relatively unnecessary. All that's changed. I flew out from the East Coast to the West Coast today. Cost me less than an hour and a half in the ICU. Distance is no longer a problem. That's not where the cost is. The cost is in the healthcare delivery system. Most of the things we do, very complex. Chronic disease requires physicians in multiple different specialties, and our system is not designed. The care you pay a lot of money for as an employer is not designed to address those issues. How many of you think you get really great health care? Come on, you can all raise your hands. I know you all think that, right? And then my question to you is, how do you know? When you have a procedure, do you have any information on the outcomes, the complication rates? I mean, medicine's good today, so most of the time we get good results. So you can talk to people, and they're going to tell you they got a good result with Dr. X. But what you don't know is whether the complication rate is 4 times as high, 8% rather than 2%, or 6% rather than 1.5%. You have no information on that. Oh, I talked to my physician, I get a referral. How does he know? He has no data either. And he rarely is going to see this person operating or doing the work. There simply is no way for you to know that, but I'm going to guarantee most of you believe that you have that until you actually get really sick. And then you discover some other things that are sitting in play. And it's even more challenging because even if you know it, you often don't act on it. And again, I'll explain tomorrow how that context changes. I'll give you one example. After President Clinton's second term, he moved to New York where his wife, who would run for president, was the senator. Now, he developed some symptoms of cardiac disease. The state of New York publishes risk-adjusted, scientifically determined cardiac outcomes for all 35 of the largest hospitals in the area. Now, remember, Mr. Clinton, President Clinton, led a lot of healthcare reform. He had access to all the experts in the world. And what did he pick for his diagnostic facility? The second worst out of all 35. Then he needs surgery, and where does he go? He goes to the worst facility by the surgeon with the highest complication rate, and guess what he gets? A complication. Of course he does. He had all the information, and it's rare to have that, and he still doesn't act on it. I'm going to tell you that that's what most of us do because our brains change our perception and data becomes less significant than word of mouth or intuition. So I'm going to argue that choice is relatively irrelevant. This long list of physicians, everyone wants to, well, if I get this rare disease, I want to go to the Mayo Clinic or Stanford. I'm sorry, I forgot where I am today. I want to go to Stanford. Now, there's very little. First, almost no one gets those really rare diseases. And second of all, it's very little. It's going to be very different about it. What you want to know is that you're going to have a healthcare system that is going to help your people avoid falling through the cracks. I think unit price is really the tool that most of you have at getting your healthcare costs managed, but it never works in the long run. Because the bigger issue is not unit price, it's really going to be utilization. And what physicians are very good at figuring out is that as you lower the unit price, they're going to raise the frequency. Now, why do I say that? Because the number one correlation with back surgery has nothing to do with the incidence of back pain. It has to do with the number of spine and neurosurgeons in a given geography. Double the surgeons, you double the surgeries. And it's not that there's a shortage before, you just find patients for whom the indications become more and more borderline to do it. And by the way, the results indicate that by a year later, you can't tell the difference between the surgery and the non-surgery. The so-called national leading medical organizations decided to do this process called choosing wisely. They asked every specialty to find 5 areas where cost reduction could happen. Some of them did a reasonable job, although not very much cost reduction. But go look at orthopedics. The 5 that orthopedics picked, not a single one of which impacts the income of an orthopedic surgeon. They're all about the referring doctors and all the things they shouldn't do and send the patient early to orthopedics. The most commonly done operation in the United States today by an orthopedic surgeon is laparoscopy with medial meniscal trimming or meniscal trimming. Very well done scientific studies, by the way, from Canada, not from the United States, demonstrated that that operation plus physical therapy is no better than physical therapy alone. It's the most common operation done. I can't tell you how much of your employee base had it done last year with no great indication. 1/3 of the antibiotics we prescribe are unnecessary. It's not the unit cost that's key. It's going to be the ability to have proper evidence-based utilization, and that simply does not happen in the current American healthcare system. So let's look at the question of the solutions. And again, you're in business. Try to think about any industry that looks like American healthcare, this 19th century cottage industry, fragmented, doctors scattered in small offices around the community, hospitals in every town. You would never do that. You would have consolidation, you'd have specialization, you would make a lot of changes, and yet in medicine we just say that's the way it is. Because it's left over from the last century. And getting it to change is going to be painful, so people avoid doing it, and that's why the choices you have, less so in California, but most of the rest of the nation, are so much fewer than you have in almost everything else that you buy as a business today. Integrate. Have people in the same specialty working together as one. The biggest problem in medicine is the small n. I teach at the business school. When you have a small n, you can't provide convenient access without redundancy of cost. And so most people instead provide delayed access. When you have a larger n, when you bring people together and patients can go to whoever's available in a specialty area, all of a sudden the access can become same day. And integration vertically between primary care and specialty care. When you're seeing the primary care physician, most of the time with a telephone call or a video visit, you can resolve it at that time, rather than having your employee now miss a second day of work to come back, or a third day if they need diagnostics in between seeing the specialist going forward. Integration of care, primary care, specialty care, hospital care, is essential. We pay physicians on a piecemeal basis. We pay them on, we call it a fee-for-service. Try to imagine telling a contractor, come to my home and build whatever you want, I'll pay your time and materials. That's basically what you do today. And I don't care whether you're self-insured or not self-insured, that's basically the process that occurs today in American medicine. You'd never do it anyplace else. As soon as you capitate a population, now people focus very differently. They start to focus on prevention. They start to focus on avoiding medical error. They can now put the systems together to be able to get the best value for you and your patients. They start to avoid disease as much as do disease. And they start to use technology. 1/3 of the time your employees go to a physician, that problem could have been addressed with a video visit. And 2% of American physicians offer it today. Why don't they offer it? It's not that it doesn't work. The quality is actually better because you don't delay getting seen. You get it seen right away. The reason is they don't get reimbursed. And if you can't bill for it, you're not going to do it. It's very hard to convince someone to do something when they're going to actually economically lose as a consequence. That system is broken. And finally, technology. How do we believe in the 21st century we can provide the best care unless we have information? Very few of you, unless you're in a system, have all that information available at every point of contact and have the physicians able, regardless of their specialty, to act on it. That comprehensive care, information is so essential, and it's so missing. If we had a lot more time, I could talk about why the electronic health record today is so problematic. But I wanted to simply talk from the patient standpoint, why not having the information creates risks to their lives. My father would be alive had his physicians had a comprehensive electronic health record, or had he carried it himself on his iPhone or wherever else he was moving it. So what's going to happen if nothing changes? And in many ways, I think of this as the White Walkers from Game of Thrones. They're sitting there outside the wall, and as long as we have that tall wall, no one thinks they're ever going to penetrate into our reality until this fire-breathing dragon comes and melts it down, and all of a sudden, it's here. It's called disruption. It's called a strategic inflection point, when the world changes in ways that we never could imagine. And that's what I would say to you, the people in the room today. Those White Walkers are coming. I can't tell you when, but they will be here. For those of you who sell insurance policies, it's called Bernie Sanders and single payer. 4 months ago, I laughed at it. Today, I don't anymore. When I go around and speak to people, the number one question I get, and I don't mean from extreme people, I mean from mainstream individuals, is why don't we have a single payer? And I can give a lot of reasons why not. Don't get me wrong. But having said that, if we don't solve the problem, the insurance world will be out of business because the insurer will become the federal government. If you want to let that happen, let it happen. But if not, my advice is intervene. And for those of you in the HR world, you're going to have a lot more unhappy employees year over year over year. Why do I say that? Because the out-of-pocket payment for a single individual in the United States today is now over $1,500. For a family, it's close to $3,000. Because you've solved the problem of the past 5 to 7 years by transferring more of that cost to your employees than you company paid. Not every company, but overall, statistically. And that simply can't go on. They can't afford it. This is post-tax dollars. And an employee making $50,000 can't spend $5,000, 10% of their income, on the added parts of their health care every single year. And for the physicians in the room, it's called disruption. Devi Shetty is a friend of mine. He's a heart surgeon in India, trained in the United States. If you ask Devi, what does he do? He'll tell you that he sets the price for a human life. By the way, he was Mother Teresa's physician. This is a very famous individual. I would ask him, what do you mean by that? He says, every morning there's 30 moms and 30 babies. In India, only about 10% of people have insurance. And I have to tell them the cost, which, by the way, in India is $1,800. And the families that can borrow the money, the child lives. The ones that can't go home and the child dies. He says, when I get my cost down to $1,500, then I'll save more lives and elevate the value of a life. I don't believe you're going to send very many of your employees to India. But Devi Shetty is building a hospital in the Cayman Islands. 7-mile white sand beach, tourist economy, speaks English, totally safe. He's building a 2,000-bed hospital on an island of 50,000 people. That'd be like building a 2,000-bed hospital in Palo Alto for its residents only. That's not why he's building it. He's building it because Miami's a 1-hour flight away. And there's this country called Mexico that borders California. And the growing population in California, Latinos, a third of whom want to speak Spanish. They speak Spanish in Mexico. And at some point, physicians will go down there and build world-class facilities and world-class care. If we don't change American healthcare, if we don't integrate it, bringing people together in one group, could be Stanford, it could be Kaiser, it could be the community physicians, groups of physicians working together as one. If we don't pay them on a capitated basis so they have the incentives to do the right thing to prevent disease, not just treat disease. If we don't make sure they have an integrated computer system so that all of the information on every patient is available to every physician caring for them, and if we don't invest in a leadership structure, that we will fail, that we will, at some point, either see the American healthcare system devolve, or what we will see is someone else come and take it over. My personal mission in writing Mistreated was to try to open people's eyes. If every one of your companies demands 5 years from now, September, whatever it is, 2022, that you've got to be integrated, capitated, with technology of the 21st century, or we will not allow you to take care of our employees, I guarantee you American medicine will change. Thank you very much. Join the journey.